A lot of people have a lot of questions about what they should and shouldn't do after surgery, and they're often really afraid that they're going to do something to mess it up. And that's great. We definitely want you to follow our instructions, but most of them are pretty simple. So here's a general rule of my instructions for activity after surgery. So when you get home from the hospital, you're going to be a little groggy, you're going to be a little bit nauseous. Just kind of rest and take it easy. Manage your pain and nausea. And you have to get up to go to the bathroom. I want you to get up and go to the table for meals so you're not just stuck in bed, but you don't have to run a marathon. And then as you feel better, as you're managing your pain, I do want you to get up and walk around as much as you can, at least 3 times a day after your surgery. And so doing this will prevent bad things like blood clots after surgery, pneumonia. You just want to keep breathing and moving as much as possible. Now, in terms of strenuous activity, you do want to avoid that. So no lifting anything greater than 10 pounds, which is about the weight of a gallon of milk, for minimum 4 to 6 weeks after surgery. And you don't want to do anything that's really going to get your heart rate pumped up or your blood pressure pumped up. And the reason for that is when we do surgery, you have lots of tiny little blood vessels, and we use something, it's like an electric pencil to cauterize them, which forms a little scab on the end of each of those little blood vessels. Now, that will take time to heal, and if you do something like go for a jog, that's gonna blow that clot right off of there, and it can even cause bleeding up to even 3 or 4 weeks after surgery. So really, I know you want to get back to your normal self, but just take it easy for, again, minimum 4 to 6 weeks after surgery. And I'll be seeing you, and we can go over your individual restrictions, but just, again, no lifting anything heavy, no crazy activities. Now, in terms of other things, when can you do those? So shower, I want you to take a shower. So 48 hours or 2 days after your surgery, your top layer of skin should be healed, and I want you to hop in the shower. You should have paper tapes or steri strips over your incisions. Just leave on anything that's stuck to you, but anything that's not stuck to you, like a bra or gauze, can come off. Hop in the shower. Usually it feels better if you put your back to the water so it's not hitting that surgery site directly, but it's fine to get everything wet. Use soap and water. Don't stay in there for 2 hours. We don't want to soak the tapes off, but just quick shower, and then pat everything dry afterwards so you don't have any damp spots on those steri strips. And some people even say they like to use a blow dryer to speed things up, so you can do that, just be careful. And that's showering. So again, the water in your shower has less bacteria than the bacteria that live on your body, so I want you to take a shower. Now, if you have specific instructions, like a skin graft or something special, then follow your particular instructions for keeping that dry. But in general, showers are good. Another question that people ask about a lot is, when can I drive? And driving is not allowed while you're on narcotics. So if you're on any heavy-duty pain medicine, Valium, anything like that, no driving. But if you're just taking ibuprofen, Tylenol, and you feel comfortable that you could slam on the brakes or turn the wheel, then you are allowed to drive. And I tell people, just start with a little drive first. So don't hop on I-25. Go to the grocery store and see how you feel. And if you feel comfortable, then you are allowed to drive. And so those are the main instructions for after surgery activity. Shower at 2 days. Anything stuck to you, leave stuck on. Anything not stuck to you can change. Walk as much as possible. No heavy lifting and no crazy exercise. And those are the basics. Again, if you have a question about you particularly, feel free to let us know. But that's just a review if you have a question in the middle of the night and you want to see if it's okay. So take care of yourselves, and those are the activity instructions.